Hi, everybody. This is Marketa Houskova. I am the Executive Director of ANA California, and I'm joined here today by our ANAC contracted lobbyist, Roxanne Gould, and I'm so happy we're here together again to give you a quick legislative update for February 2022. Hey, Roxanne, how are you?
Hi, Happy New Year.
Well, yeah, it's middle, end of February, but it's good. Happy New Year is always good. It's, to send well wishes is always good. How are you? How have you been? What's going on in the legislation? With legislation, is the building open? There are some deadlines coming up. What happened to the 2-year bills? Just give us a little bit of overview where we are.
Wow, it's a lot of questions. Okay, so where we are.
But you got it.
Second year of a 2-year session. So when you talk about 2-year bills, if a bill was introduced in the Assembly in 2021, it had until the end of January to make it out of the Assembly or it failed passage. So we're now very well aware of what survived and what didn't from 2021.
So failed passage means that the bill is dead, right? We call it bill is dead. It doesn't go anywhere and it's done. Okay.
Exactly. And the legislature reconvened for the second year in January. And so legislators have been introducing bills for this second year of the 2-year session, and their deadline to introduce bills is this coming Friday. So we've seen bills get introduced, but it's just been a trickle. Every legislator has a bill cap on how many they can introduce, and many legislators are still waiting to introduce what are likely to be potentially the most controversial. So we'll see, I think, a big bill drop on probably we'll see them over the weekend or on Monday. So we'll really know what we're going to be dealing with this year after that deadline happens. And so,
but there was already some action, right? Because, let's say I know that we've updated our Leg Committee on the AB 1400, the single payer bill, but there was already some interesting action, right? Can you talk about just about it just a little bit?
Well, I mean, there's still a ton of focus on COVID, obviously. And so there have been bills around vaccinations, around mask mandates. There is a bill that requires kids 5 and over, I believe, to be vaccinated with COVID or against COVID if they want to go to public schools. There is a bill that allows 12-year-olds to go ahead and get a COVID vaccine without parents' knowledge or permission. There have been talk about bills to mandate, safer school cleaning products, because they're now used to be cleaning classrooms after the kids are gone and there's time to air out and kids come back the next day. Now it would be when in between classes when kids are in recess, and those products might not be the safest thing to use. There is a reproductive health bill. There is a bill that talks about after you have a baby, and maybe you can remind me of that. I think it's 1930, Marketa.
Yeah, AB 1930, yes.
And that deals with postpartum care for up to 12 months. Can you think of others? I mean, there's an initiative that talks about making it's equity in healthcare, I believe is the title of it, but it's talking about addressing Bill AB 5 from a few years ago that tried to identify what is defined as an independent contractor and not. And it was targeted in theory after things like Uber drivers, DoorDash drivers, but it opened its arms and includes everyone, including nurses. And so we talked about at the time, in one instance, rural communities, a hospital may not need a full-time nurse or a bunch of full-time nurses. So a nurse could contract with multiple hospitals. And so they're employed, they're doing their job, and hospitals are getting the care and nursing that they want. That went away because nurses could no longer be considered independent contractors. So we're still reviewing the language on that. So devil's in the details, but that's something we're definitely going to be paying attention to as well.
And Roxanne, what happened to 2-year bills that we were watching? I know that the AB 1400 single payer that didn't go any further because Assemblyman Kalra, he realized that he didn't have the votes on the floor of the assembly. But the idea is not going anywhere. I'm sure that it will be brought up next year again, or next legislative session. So that's something that we'll keep our eye on.
Right.
What about the other 2-year bill? I think that majority of them didn't make the deadline, January 30th, to make it out of the first house.
Well, part of that is because the bills that become 2-year bills are often the most controversial. So they're already an uphill battle in the first year. And if they don't make it out the first year, it really pretty impressive feat to get it out in the second year before the deadline for the 2-year bills.
But there is this one bill which, you know, Roxanne and I, we were outraged last year when it didn't make it out of the House of Origin, and that's AB 562. That's Evan Lowe's bill, and that is offering mental health resources and mental health support for all healthcare professionals who are taking care of COVID patients. And we know the status of mental health and moral resilience and how distraught and tired and exhausted and burnt out nurses and our other healthcare professional colleagues are. And so I know that I was really outraged that the bill didn't make it through, because it's great that when, you know, you're celebrating us and you're thanking nurses, but when actually it comes down to then you need to do something for nurses, you know, they were unable to actually help us. And that I was very outraged over it, but we were hoping it was a 2-year bill. We were hoping that it will get out of assembly, but it didn't. But again, it's not going anywhere. You know, legislators.
The issue isn't going anywhere for sure. It's absolutely still a crisis and something that needs to be addressed. And so I'm hoping that they continue. Maybe one of the bills that are introduced will be, you know, reinvigorating that idea. Let's hope.
And you know, and especially since ANAC held a mental health and nursing discussion panel with, you know, Dr. Bonnie Clipper, Dr. Bernadette Melnick, Dr. Dan Weberg, Dr. Jim D'Alfonso, our own president, Dr. Anita Girard, and it was spearheaded and moderated by our fantastic ANAC fellow, Caroline Duenas, and it was a massive success. That event, one of the best events we had, and all what we were talking about it were the barriers to actually nurses reaching out and getting mental health support or, you know, overall psychological help. And we were compiling resources. Resources are great, but if there needs to be a law change, somehow California lawmakers are unable to do that for us, and that's a problem. So that's something we need to keep working on.
Absolutely.
Yeah. And then, so we kind of talked about where we are. Is the building open? I mean, you know, the building, State Capitol, is it open, or what's going on there?
Well, I mean, it's there was an evaluation. The Capitol is, for those of you that have been to Lobby Day, the Capitol has the typical Capitol with a dome, has 4 floors, and then there was an annex built next to it to provide more housing and committee rooms, 6 floors. There was an assessment conducted, and they determined that that annex is not earthquake proof. It has asbestos. It's not ADA compliant. So basically, the decision was made to tear down the annex, create another building that they're calling the swing space, about 2 blocks away. So for the time being, the larger room, such as one we've used for Lobby Day in that annex, is still open, but capacity is limiting attendees definitely as a result of COVID concerns. The annex will go away and they will rebuild, but in the meantime, they are having every legislator and every staffer that was in that portion, which is probably 90% of all staff and legislators, they are now housed in that annex, and they're yet to have any committee hearings over there. It's still sort of there. Most legislators are pretty unhappy with it because it's a very different configuration. Most of it is completely open space. So instead of having a private office to have a confidential conversation about a bill, you could be in a place where someone who's on the opposing side, a few feet away, hearing your conversation. So that's yet to play out, but it's I would say it's definitely in disarray, and they're still trying to figure it out. They actually just imposed mask mandates. The mask mandate in California was just
lifted.
Exactly. But the Capitol, they issued a proclamation or decree that masks are still mandatory in all offices, all hallways, all meeting rooms. You don't have to have one if you're in private office, but the Capitol is definitely opening up much slower than California.
Yeah, and I think it has some repercussion or there may be some consequences to our Lobby Day. We were expecting that that the restrictions will be lifted, at least by the end of February, completely lifted. And so that's something that we are monitoring and watching, and we'll see, because you know that we bring 220, 230 people inside the State Capitol for our Lobby Day. But so far, as of right now, you know, we would be limited to maybe 1/4.
Mhm.
that capacity. So, that completely changes what we're going to do with the event. So that's something we'll be monitoring and we'll be
Right.
keep updated on. But so far that's where we are. All right, Roxanne, do we have anything else? Or I think because right now we're still waiting, right? There is the Friday
Right.
deadline. We're monitoring, we're keeping up with, not Kardashians, but not the Joneses, but we are keeping up with the legislators. And I think that let's connect maybe in 2 weeks. By then we
Mhm.
should know what other bills were introduced, and we'll have more to share with you. Plus also upcoming, we have legislative call, right? The call of legislative committee that's coming up. And then I think that Teresa already sent out a doodle, or she already sent out the calendar invite. So it should be on your calendar. So again, it's going to be Roxanne, me, and our new fabulous legislative director, Laura Chechel. So it's going to be the trifecta again talking, and we look forward to seeing you there. If you have any questions, you know where to reach us. You can always shoot me an email. And I think that's it. So we want to really thank you for being here with us. Thank you for your ongoing dedication to this organization, and especially for your membership, because it is thanks to you and only you that Roxanne and I and Jared and Chelsea and Teresa at our office that we can be here and we can do this marvelous work. And we're very grateful to have you. So Roxanne, thank you so much. Thank you for your time. I appreciate it. And I look forward to seeing you, Roxanne, and you, everybody, in 2 weeks or so. Thank you so much. Bye.
Bye.